Now we're going to start with the C side. You have to put the device like this. Like this, ready? We will look for the start of our cervical. To locate them correctly, we'll put our fingers here, which is where the cervicals start. And remember to put the side C cervical. It'll be very simple. You'll lie down, locate where the cervicals start. There are some tips, and adjust it like this. If you feel it moves, you can hold it with your fingers. If not, you relax. Since you are just starting your therapies, remember that the cervical side has some tips. If you are sensitive, I recommend you put a towel over and you'll feel better. You adjust it and it's ready. Now, if you feel it slips, you can put a little towel on your shoulders. Now I'll show you where the 6th and 7th cervical are. It's very easy. Turn around, lower your chin, and right here where you have a little curve, right here where you feel it, that's the 7th cervical. Put your finger a little above it, and that's the 6th one. Now we'll work our 2nd cervical point. Remember, it's where I told you. Locate the little curve, adjust it, and it's right there. Remember to breathe in and out slowly. Your legs can be positioned at your comfort. They can be completely stretched or flexed. Now, if you want to feel more pressure, hold your hands under your neck, rest, and take your chin towards the chest. Remember to have with you a little towel. If you feel pain, get up and put it over the device. And go back to your position. There is also a way for you to have more support. You can put a small towel over Cordus, and this way you'll have more pressure on your cervical. Now that we're done with the cervical side, let's send the message to the nerves that everything is okay. We'll do an exercise. Breathe in, breathe out, chin to the chest for 7 to 8 seconds. Legs stretched. Then go back and we flex the legs. Breathe in, breathe out, chin to the chest, and go back. Very good. That's it. Let's continue with the dorsal side. Remember to rotate, and you'll have the letter D. From where you were, lower it between 6 and 8 centimeters. Lay down with your shoulders and adjust yourself slowly. Breathe in and breathe out. If you feel some pressure, remember to have your towel with you. And you can put it right here to feel more comfortable. Okay, now let's move on to the second point of the dorsal zone. We have some books to give you support. Remember to have it on letter D. You'll slowly lift and put the books at the level of the hip. Okay, now look for the level of the upper stomach. And right here, put the device. That's it. You can do it with your legs flexed or stretched. Stretch slowly and relax. Let your own weight fall on the device. If you want more pressure, you can take away one book or all of them. And if you don't want as much pressure, you can put more books. Remember to go back down very slowly. Also remember that if you have scoliosis or too much pressure in your dorsal zone, you can get support from a towel in the shoulder blades zone and the books in the coccyx zone. The device keeps doing its work. Remember to provide support to your body. You can use a small pillow, a towel, or the books. Ready. We have finished the time. Remember to lift your hips softly and take away the books. Then take away the device and we stretch. This is in order to reactivate your back muscles and nerves. Stretched. Stretch your arms. Remember to turn around your device to the L zone. As I have said, it must be perfectly positioned and firm where the curve is. We're going to lift the hip to have a support. Slowly lift your hip and put your support, your books or notebooks. Once you're comfortable, we are going to look for the belly button and from that level go 1 centimeter above and put the device. We are going to lift again, adjust it, and go down slowly. Remember, you can have your legs flexed or stretched. There's no problem. Breathe in and breathe out. Now let's continue with the second phase of the lumbar zone. Lift your hips like we were previously, then softly lower it and locate the part where we have small bones in the spine. Right there is perfectly fine, before getting to the sacrum. We go down very gently over the books and you can stretch your legs or leave flex them. The point is that you feel comfortable. Nothing should hurt. You should be comfortable the whole time. And also remember that you have to feel always comfortable. You can use books as a support, as well as a pillow or a small towel. Stretch and just relax. If you have some kind of problem with the sciatic, we'll do it as follows. Take away the books, put a towel in your lumbar zone, and gently lift your hip, and then we will put it in the middle of the buttocks. Then you can stretch, or if you feel too much pressure, you can also flex your legs. This is going to help you free the sciatic nerve. And if you feel too much pressure at this point, move it a little lower until you feel comfortable and relax. Very good. You're doing it very good. Now to finish, we'll continue with the coccyx. Remember to turn the device to the D side. Gently lift and locate the last little bone that we have in the spine. Adjust it correctly, and then go down softly, step by step. Very well. Now we have finished with the last phase, which was the coccyx. Remember to gently lift your hips and relax. That's it. Now that we've finished, we'll do a relaxing exercise to reactivate the muscles as well. Flex both your legs. You can do it by the upper side or the lower side of your legs. Now breathe in. Lift yourself and take your chin to your chest and breathe out for about 8 seconds. Gently go back down and gently and slowly stretch your legs. Now we have finished and we will reincorporate. Remember to do so very slowly. Okay, so now we're going to relax. Take your knee to your chest with a 20 or 30% of effort. And remember that as you breathe out, you are going to pull your knee to your chest like this. You are going to do this for about 1 to 2 minutes with each leg. If you have a problem with your flexibility, don't worry. You can help yourself with a belt, like this. You pull towards your chest with a 20 or 30% of strength. Remember that when you pull your legs, you breathe out. And well, honestly, the device is so helpful that if you are overweight, or if you have delicate problems in your spine or your spine is weak, you can do it seated. It's very easy. Remember, we start with the cervical, the C, and the little arch. We position it, and we relax. After 2 to 4 minutes, depending on how you feel, lower it to the second point of the cervical, right here. And if you feel the device slips, you can hold it with your fingers, or you can put a towel under the cordus. Adjust it. Your legs aligned with your shoulders, and rest. Remember, you can do it like this, or you can push yourself back like this. Remember, you can put the desired pressure on your back. Position your device. Right now I'm going to put it on the lumbar zone. I rest, and I let all my back fall. If you feel it's too much pressure, get back up towards the front a little. There shouldn't be any kind of pain. You need to be comfortable and enjoying your therapy. Also remember that if you don't wish much pressure, you can use any type of support. This time I chose a cushion. I adjust it with Cordus, and I relax. All right, now we'll proceed with the dorsal zone. Since it's a bit complicated for you to do it on your own, if you don't have anyone to help you, you can use a towel, attach a spring to it. Remember, it's the dorsal side, so we'll put it on the D side, just like this. Very well. Now we'll put it over here, like this. You position it at the dorsal level, and it's ready. Now you position yourself perfectly well, and you can adjust the towel to the level you want. Remember, it's very important to align your knees to your shoulders. Breathe in, breathe out, and relax. Remember that like this, you can move and adjust the towel to the appropriate level for you and work your spine perfectly well. Now adjust yourself, let it rest, and relax. Remember that in this way, you can work your whole spine. Just remember that once you get to the lumbar zone, we'll lower it and adjust it to the L side. Now adjust yourself. And it's ready. Relax. Once your session is finished, remember to stretch, and that will help you a lot in reactivating your muscles. Breathe in and breathe out and take your chin to your chest. Stretch all your cervical very well. Now lift your arms and stretch as much as you can stretch your whole spine slowly and gently. Remember to do this for 2 or 3 minutes. And remember that in order to reactivate your lumbar muscles, we'll do this exercise. We lift and cross our arms and breathe in. And while you're turning around, breathe out. Breathe in. Breathe out as you get to your middle point. And the same, breathe in and turn around to the opposite side as you breathe out. Breathe in again. Breathe out. Slowly breathe out and get to the middle point where you started. Hi, how are you? I'm Lulu Rosillo, and I want to tell you about my great experience with this device called Cordus. Some friends from Germany came over and told me that they're coming to check out this product because it was recommended to them. My friend had an injury in the vertebral, and I have a spine surgery in the L4 and L5. I have an implant. It would be great if everyone could always end up perfectly well from surgeries. I ended up well, thank God. But you always end up with a chronic pain, and I couldn't handle it anymore. I had already tried massages, chiropractors, yoga, Pilates. I injected myself with cortisone, and well, so many things that one does to feel better and take away the pain, apart from taking my swimming classes to stretch my spine, and for it to have the necessary spaces in between the vertebrae. My friend came and told me about the device, and I, always trying to feel better, agreed to go with her. We went, I tried it, and I loved it. I got there, and I was quite doubtful, because you just don't believe anymore that you could go back to feeling 100 or 90% well. And they carried out the test on me. The test is free. It's 40 minutes long. They explain perfectly well how to do it, and I couldn't believe that with such a small device, you can align your spine again. From lumbar, from cervical to lumbar. I tried it, and by when it was finished, I began to stretch, I began walking and ducking, and I was left super convinced. I already wanted to change the bed's mattress. I've taken all the pills and shots there are, and truly, from the bottom of my heart, recommend you come and try it. You can have a free therapy, and you can decide if you want it or not. If not, they give you your money back. I truly do it from the bottom of my heart so that you can feel well. I have definitely tried this. I could show you my spine scar, and I wish that people don't have pain. Those chronic pains that seriously make you neurotic and be in a bad mood because you don't feel well. So, I invite you to try it, to get an appointment, and to invite people that maybe have pain in their arm, neck, or back, because at the end, everything goes through the spine. And from the very bottom of my heart, I truly recommend it a lot. It's very simple to use in any place. I take it on my trips to my house, which is your house, really any place. You can use it seated, and the improvement is seriously instant. But I have already told you about it. Come on over, try it, and I hope you feel as satisfied and as happy as I did. Thank you.